Hey, Catalyst community. We just finished a fascinating interview with Dr. Abbie Smith-Ryan out of the University of North Carolina. She and her team just recently, in the last few weeks, had an article published on the nutritional considerations both post-injury and post-surgery to speed up the healing process and support that healing process. Fascinating insights, really valuable info. We want to get this unedited video version out to you ASAP so you have access to it if you're here on the YouTube coaching channel with us. The edited version, as always, will hit the Catalyst Health Wellness Performance Coaching Podcast in about 2 weeks, so you can be looking for that. But in the meantime, want to get this to you ASAP. We will link to her specific article in the description down below, so you can check that out if you want to dig into all the details. So with that, go be a catalyst, enjoy the interview, and we'll talk to you soon. Take care. Well, today, huge pleasure. We have Abbie Smith-Ryan, Dr. Abbie Smith-Ryan out of UNC joining us today on a topic that is so critical. There's not a lot of attention on this, and we want to try to bring that to the forefront. So, Dr. Smith-Ryan, we are thrilled to have you here. Thanks for joining us.
Yeah, thanks so much for the opportunity. Glad to be here.
So your article, for those watching on the video, they just had this article printed in the Journal of Athletic Training, and it basically states the unfortunate obvious is what I'm calling it here. And in the first sentence, nutritional interventions are not commonly a standard of care in rehabilitation interventions. And we could expand that to healthcare in general. What's up with that? Why do you think that's the case?
I think a lot of it is scope of practice or people's perception of scope of practice. And so you have medical doctors that don't get a lot of nutrition training, and then you see like physical therapists and rehabilitation therapy that they don't get a lot of training or think that it's not their scope of practice. And so who does that leave it to? The nutritionist. But a lot of times in registered dietitians, they're not in the trenches, you know, as far as, so I think it's just part of why writing the article and my passion in this avenue is to get it into hands that then changes perspective, that we can have this conversation and then make it part of standard of care.
Beautiful. So everybody listening, it's our job. We got to get this thing out here, and we will have a link in the description on both the video and the podcast for this, so you can share it with folks. All right. So you cover both preoperative nutrition during the rehab process. What differences between the pre-op and the rehab process, or are they essentially the same?
It's a great question. So I think they're a little bit different. One thing prehab or whether it's surgery, one thing that I find pretty interesting is that typically when someone's scheduled for a surgery, the general recommendations that we're given is to fast the night before.
Yeah, that's it.
And it doesn't matter if your surgery is at 6 a.m. or 2 p.m. And a lot of that, I think, we have to recognize a lot of that's more of a concern of if you're using anesthesia. And so the risk of aspiration or some of that. But when you look at physiology and digestion, we're doing ourselves a disservice. And so there's two takeaways I look at it. There's good data that suggests that leading up to a surgery, if you actually do somewhat of a carbohydrate load or a glycogen load, so basically increasing the amount of carbohydrates, particularly like our high quality fibers and our complex carbs, that can help with surgical outcomes, because anesthesia does something to our ability to break down carbohydrates and kind of our glucose control. So that's
almost like a race. And you're talking 3 days before, a week before. What is the general? And I know it hasn't been deeply studied here, but just generally,
I would say about a week before.
Okay.
Yeah, so nothing crazy, but that's something that easily we can do. Increase our fruits and vegetables, increase our kind of high quality carbohydrates. And then I think one thing that, let's say you forget, or, who has time for that? If we can really take advantage of the night before and the morning of, it can have, in my mind, physiologically huge implications. And the nitty gritty of that is the night before a surgery, you want to think about having, like, how do I have, keep all of my nutrients readily available, especially if I need to be somewhat fasted, or when am I going to eat again? And so what kind of the research suggests and what we recommend is that evening before meal, maybe plan it a little bit later, and then make sure you have a high quality protein. So usually that's an animal protein, a complex carbohydrate, so it's slow releasing carbohydrate, and then a high quality fat, so essential fatty acid that, again, kind of all those nutrients are readily available.
Okay. Okay, good. And is that something they should bring to their doc? Because like you say, the advice is very straightforward. Fast from midnight the night before in almost all cases. They're starting to make some exceptions with afternoon surgeries now, but is that something they should bring to their doctor and say, hey, I was reading some stuff and what would you think?
Absolutely. So I think the night before is nothing, that's still following the
Right.
guidelines. So
Sure,
I would
sure.
just, be real cognizant about that meal the night before. The morning of is where I think it gets a little bit less clear. One thing, like I never want to say go against the laws or
Sure.
your doctor's advice.
Absolutely.
In other countries, that law is not there. I think in the US, there's a lot of concern about malpractice and more concern legally. But when you look at the guidelines, it's usually fast or clear liquids only. Is that what they told you?
Totally. Yeah.
Okay. So then when you take that step a little bit further, the clear liquid. So when you look at digestion, if you think about a clear liquid, it's going to absorb within a couple hours, even quicker than that.
Right.
So then if we look at trying to take advantage of that clear liquid, can we get some glucose, some carbohydrate that's easily digested, and some amino acids? Again, that's easily digested. None of that's going to be in the stomach when you go under anesthesia. So it's not necessarily disregarding the doctor's advice. It's just taking advantage of that clear liquid.
Right. Right. Yeah. Taking those options and saying, okay, so that's pre-ab or pre-surgical. Now surgery's done. We're in the rehab process. What are we doing at this point? And we're going to go through the specific 5 areas in detail here in a minute, but just generally speaking.
Yeah. So post-hab, there's a few things to think about. One, I think that to me is like a top priority is that often post-surgery, you have some sort of pain reducer. You're not as active. And so appetite is not, there. Yet our caloric needs are elevated.
Yeah.
And so one reminder is just making sure that you know that you need to eat. And if you don't, then you're going to lose more muscle and, hinder some things. So that can slow rehabilitation.
So let's jump on that for a second. So caloric needs increase. Let's go back into that because a lot of people are probably sitting there thinking, well, I'm used to working out 2 hours a day or an hour a day or whatever, or I'm used to walking around at work and now I'm sitting on the couch or I'm in my bed or I'm restricted to a desk. So I've been cutting back because I don't want to gain 20 pounds while I'm in my post-surgical aspect. Talk us through this. Well, wait a minute. No. You need more in that post.
Yeah, so I think there's a couple things to think about. It's definitely individual specific. And so, yes, if you're going from training 3 hours a day and it's a minor surgery, you're probably not going to need the same amount of calories. But it's important to recognize that anytime you're healing a wound or a muscle or a ligament, it does increase your metabolic rate. And so we can calculate that. You get your estimated basal metabolic rate and then kind of your activity coefficient and then what we call a stress factor. What I like to think about, it's usually a few hundred calories extra, and it very much depends. Like it's very different from a shoulder surgery versus like a hip replacement.
Sure.
And so you have to think, I always just think about it with an athlete, or if you're exercising, that's you're burning calories. But when we think about a wound, it's your body's on overdrive trying to repair and recover, which takes a lot of calories.
Yeah, that's a huge point. I didn't even think about that. All right, so let's dig into some of the details. What are some of the key strategies for improving our rate of recovery, either post-surgical or just while the injury's going on, even if a surgery is not really involved? And you talk about this in figure 1 is one of the very nice diagrams you've got there. Can you talk us through that piece a little bit?
Yeah, I probably should have printed mine out.
Here, I'll give you a cheat sheet. There you go.
Yeah, no, I have some knowledge of it. I think so when we talk about nutritionally, now there's a number of like therapy things that you hopefully have a professional helping you with. Nutrition, as you mentioned, is not often part of it. And so beyond the calories, I think it's even recognizing like you may not have that hunger, you still need to eat. And then it's like basic things we should be doing, but here's the friendly reminder, right? Like increasing our colorful foods, making your plate very colorful. So fruits and vegetables, because that has anti-inflammatory properties. Increasing protein, because that has key, we need amino acids to help rebuild and prevent muscle loss. essential fatty acids, so like our omega-3s and our omega-6s, that goes in and rebuilds the cell wall. And so it can potentially help kind of recover faster, the incision and the injury itself. And then there's like a host of dietary supplements that have some good data in addition to this kind of improvement in diet.
Okay. All right. Well, let's dig into them. So we've touched on a few of these, but let's take a deeper dive. First up, and I'll just list them all out for the listeners first. We've got calories, you got protein / amino acids, you've got carbohydrates, you got fatty acids, and you got supplements. And she's got about 1, 2, 3, 4, about 6 or 7 supplements. So let's start with calories. What do people need to be keeping in mind in terms of calories? And you've touched on this, so you can say, well, rewind 3 minutes, Brad, but anything else in terms of the calories that maybe we haven't touched on yet?
I would just say, if like people know how many calories they need, then that's a good start. How do you identify that? Well, we've put some numbers in the article, but essentially do a quick estimate online, like what's your basal metabolic rate, and then kind of estimate how severe the injury is, how much recovery, and then it's it ranges, I would guess, from anywhere from like 200 to 500 additional calories.
And when you say how severe, is it body size? Like you talked about a hip replacement, like that's center of your body. There's all these things that are smashing and breaking. Whereas, for example, I had my labrum repaired and my biceps tendon stapled. So not as much involvement on my part versus somebody that had a hip replacement. Are there other things besides size of your finger versus your knee? Anything else that people should take into account?
Yeah, so I think how much like other accessory organ damage, like how much muscle mass with how much bone, the age of the individual.
Okay.
So if you think about like the older we are, the more help we might need, or the longer we may need to recover. And then even like how much mobility you have, or how much activity you can do on top of what you can do already.
And we're going to talk about the nutrient dense aspects of these things as we go through this list. But I think that's I'm not the expert here. I'm guessing that's the emphasis here. It's not just, you need that 300 extra calories. So 3 Snickers bars and you are golden. Are all calories created equal?
Well, no, that's a softball.
Was that a nice softball for you?
Yeah. I mean, realistically, I think the takeaway is that nutrition can play a huge role in how fast we recover, but we ultimately have the choice of what we want to do and not to do. Right. And if I had to rank it, like if we can improve, you mentioned a Snickers bar, if we can improve the carbohydrate quality, that can help, maintain blood glucose and help some things. The research really shows that protein is a driving factor in recovery and really minimizing muscle loss. And so, I would focus there. And then our essential fats, that can really help with healing. Some of this stuff, like you're going to get it in your diet anyways, but it's really kind of saying like, what can I feasibly focus on and really like put my mind to?
Right. Okay. All right. So let's jump into protein and amino acids. You touched on this. Let's take a deeper dive. Let's help people understand what do we need to be doing here. Is there a certain recommendation of grams per pound or kilogram of body weight? We did have Stuart Phillips on 6-8 months ago. He is the protein guy. He was a great interview, but awesome. I would love just to have you fill that in for people that maybe didn't catch that or going specifically with the surgery piece.
Yeah, I mean, I think so based on some of the data is higher. So we're talking like 2.2 to 2.4 grams per kilogram is a good place to start. That's obviously kind of dependent on how much you're consuming already and if it's more plant-based, but that's a good place to start. So okay. Elevated protein intake.
And just to repeat for everybody, 2.2 to 2.4 grams per kilogram, correct? Okay, perfect.
And then the other key piece that I think is maybe even more important is the timing of the protein. And so you really want to prevent these big gaps throughout the day or fasting periods. And so generally speaking, about 30-gram boluses kind of evenly spaced throughout the day is what's most optimal. And that 30-gram dose really depends on how much muscle someone has. I'm sure Stu talked about some of that. So, someone that's much larger could get away with having 50 grams at a time, but it's really trying to kind of evenly space that throughout the day.
Okay, good. And any specifics, you mentioned plant-based tends to be a little bit lower content. Any advice for folks just in a general nature in terms of that?
Yeah, so I really recommend the animal-based because then it has all of our essential amino acids and it's got the a necessary amount of leucine. And so usually we don't want a lot of meat products,
Right.
especially, so meaning like we might not have the hunger for them. And
Right.
so ways to get around that are things like dairy, eggs, fish. It doesn't necessarily mean like you have to gnaw on chicken breasts all throughout the day.
Got your big turkey thing going. Yeah, how's it going? I just got out of surgery.
Well, especially if you have a reduced appetite, that's where some of the like a protein supplement comes in, or like a nice rich chocolate milk, like where it's not something that you necessarily have to eat, 8 times a day.
Okay, good. You got me thinking about something, but I think I've lost it.
Happens to me all the time.
Yeah, thank you.
You need some creatine in your life.
Yeah, exactly. Oh, I know what I was going to ask you. Timing, not just timing of the day, but is this critical the first week, the first 2 weeks until pain is back to a 1 out of 10? Are there any guidelines along that in terms of how long should that person, if they're normally taking in 1.5 to 1.8, how long should they stay with that 2.2 to 2.4 kind of regimen?
I mean, it really depends on the nature of the immobilization. And
Okay.
so really the goal of the elevated protein intake is to help maximize protein synthesis or minimize protein loss.
Right.
And so, I mean, I would continue it until like even return or cleared to return to activity. Okay. And then it becomes more of like, probably when you return to activity, you need more carbohydrates. So then you need to lower that. It's all about kind of shuffling right. your macronutrient needs.
Okay. Very good. We're back to carbs now. And again, you touched on this one. Anything else you want to throw out there about carbs since we're going through the list of 5?
I mean, just trying to maintain those complex carbohydrates and, kind of killing 2 birds with 1 stone is if you can really increase your fruits and vegetables, you're getting both the complex carbs, but also kind of the inflammatory properties of a lot of those foods.
Okay, good. Fatty acids. You mentioned omega-3s, omega-6s, best forms to get those in. We're going to talk about supplements here in a second. Are you suggesting those to get that, or are you looking more at fish? And what do you suggest?
Yeah, I mean, if we can start with food first, that's the best. It's harder to get omega-3 through the diet. So our high quality essential fats. So just as a reminder to the listeners, essential fats you can't create. Our body can't create them. We must get them through the diet. So things when you think about healthy fats, those are going to be like our nuts, our seeds, our high quality oils. And it's just in our fish, our fatty fish. It's hard to get enough of that. And so something like omega-3, particularly for an injury rehab, I would recommend a supplement. Okay, good. Anything else on the fatty acid side? Yeah, I think one kind of caveat is that our body, I think the body's pretty amazing, but immediately post injury or surgery, we have this kind of innate natural inflammatory response. The best way, we're going to lose my light here. The best way
we have to keep moving.
Yes, conservation of energy. We'll just keep our activity. We have, I like to describe it, if you have an injury, the site is a lot of times warm after. That's like your inflammatory response. Right. And so we don't probably want to do high doses of omega-3 right after an injury or surgery, like 24, 48 hours. And then after that, there's some really good data that it can help not only with inflammation, but also kind of muscle protein synthesis, like the muscle fiber itself, which is pretty interesting. Okay, very good. So start those omega-3s about 48 hours after would be a general guidance. Yeah, and then dosing, I think, is an important thing to consider depending on the severity of the injury, but like a kind of a general dose, about 2,000 milligrams per day of EPA is a good place to start. And on most fish oils, that's usually like double the dose or triple the dose, depending if it's higher or lower quality. Okay. So what I do is like look at the label, it should list EPA, DHA, and then let's say it's 500 milligrams of EPA per 2 capsules. Well, then you'd want to take 6 capsules. Okay. Very good. Very good. All right. Now we're down to the one that we're going to have some pushback on, I'm sure. Supplements, a lot of discussion about, do supplements even make a difference? So we've got, let's see, creatine, HMB, fish oil,
omega-3s, vitamin D, probiotics, and a multivitamin. So why don't we go in reverse? Because multivitamins seem to get the most pushback on. I don't know if you're like me. Most of my life, I was like, yeah, it's a little insurance policy. And the more I read, it's like, it's costing you money, Brad, but it's not giving you much. So is this an exception to that general thought out there right now?
I mean, I don't think the research has really changed. I think a multivitamin, there was a reason it was last on the list. Like it is an insurance policy, but in a time of rehab and injury, or in a time where you're not eating enough whole foods or kind of throughout the day, then I think a multivitamin is a good way to try and get things like your vitamin C, your vitamin E, that really will help with healing.
And that makes sense. It's such a short time period. Yeah, it's easy. It's inexpensive. You can get them anywhere. Yeah, so it's almost like a slam dunk. Why not?
Yeah, and I wouldn't pay a lot of money for it, and just recognize it is kind of like an extra. I mean, you may not see a huge difference, but at least you know you're getting kind of those key fat-soluble, water-soluble vitamins.
Okay, good. Probiotics then. Where do we go with that?
Yeah, I also kind of lower on my list, not something I would recommend to everyone. I think the key thing, though, to me that's somewhat interesting is depending on the anesthesia or the medication, a lot of times that can influence your gut health.
Yeah.
And so it's one of those things I think we have more and more research that's coming out. Another key thing with some of the probiotics is that there's certain strains that actually help absorption of amino acids, which again is kind of the goal to support muscle. And so a lot of it depends on what your diet consists of already. But that's one of those things that could have some potential benefit depending on the individual and the gut flora and kind of what the total diet looks like.
And it sounds, if I'm reading between the lines here, that that's a good one going into surgery to add to your list as well.
Yeah, especially like there's a lot of things that can happen with immunity. Even I know people that have had surgery that post-surgery due to the anesthesia or some things, there's a lot of, I like to call them bubble guts, and depending on the medication, it's a good way to kind of keep your gut health kind of in a regular sense, especially like another thing we see with pain meds is constipation. And so obviously eating fruits and vegetables helps with that, but a probiotic can also just help keep making sure that bacteria is a good one. Yeah,
good. Yeah, we had Professor Felicia Jacka out of Australia just a couple of weeks ago, and that's her thing, the whole thing about the gut health. All right, so vitamin D, getting a lot more research about vitamin D recently. It seems like it's a really important factor in general, but in this specific situation, walk us through that piece.
Yeah, so I think the thing with vitamin D, as you mentioned, it's related to everything, but can be particularly related to bone, tendon, ligament. And the thing about it is 99% of us are vitamin D deficient. Yeah. And so it's just one of those things that you can't get enough of it in the diet. And so anytime your system is compromised or working on overdrive, you'll see those increased needs. And so, I mean, this is something that you can easily get your measures taken. So it's not like surgery is going to make you deficient. It's just one of those things that to make sure that you are in a sufficient range is it going to be important. And then the other thing, physicians have gotten so good about recommending vitamin D, but they've left out that it's a fat soluble vitamin. And so what that means is that vitamin D should always be taken with food, particularly with fat. Otherwise you can't absorb it.
Okay.
And so that's like an important factor. Like vitamin D is not going to be helpful unless you are taking it with food.
Okay. Good. Thank you for clarifying that. Fish oil. You touched on that, but anything else on the fish oil side?
The only other thing I would mention is that deep seawater, cold fish, kind of fish oil is really where it's at. There is some good data on, some potential on like krill oil, but it's really looking at that EPA DHA breakdown.
Okay, good. HMB makes the list here and it's up towards the top of the list. Talk us through that a little bit.
HMB is beta hydroxybeta methylbutyrate, which is a metabolite of leucine. And it's at the top of the list because it was originally kind of identified in a cancer population or for use in a cancer population. So it's very good at preventing muscle wasting. And I actually did some work on this a long time ago in elderly individuals. Mm-hmm. And so HMB is in a lot of formulations for rehab. It's kind of expensive. It is marketed in a sports scenario, but also you can find it in like Ensure Rebigger. So Ensure has some of it in there, but it essentially works like leucine, which is a protein stimulator, but it very much is an anti-catabolic and works more in the sedentary, immobilized, kind of reduced activity scenario, opposed to kind of these highly active individuals.
Okay.
So basically, we'll try to prevent muscle loss.
And are there certain dosages of the HMB you would recommend?
Yeah, so about 3 grams a day divided in about 1.5 gram doses. And so you could buy just HMB powder. It's also in some different products, like I mentioned, and Ensure. It is in, I think, Muscle Armor is one of those products as well. So yeah, just plain HMB. Like I said, it's a bit expensive, but it's one of those that I would pay for during kind of a post surgery or like a rehab phase.
Okay, excellent. And then the last one, creatine. Again, a lot of research coming out about that, not just for, muscle heads and post-surgical, but even just for brain health and those kinds of things. So talk us through, in this context, the value of creatine and how much to take.
Yeah, great question. And so this is one of those that's definitely at top on the list. It's cheap, so you can buy a whole thing for like $10. Yeah. And it has, the research really shows so much benefit. So there is some data that I'm not as convinced that it may influence like the muscle cell itself. But really what we see, and there's some good data that shows that when we look at dosing, so post rehab, one benefit, and even potentially going into surgery, is to do a loading phase. And normally I never recommend loading except for like an injury scenario. And what that means, it's 20 grams a day in 4 5-gram doses. So 4 times a day, take 5 grams and do that for 5 days. From there, then go down to kind of a maintenance dose, which is about 3 to 5 grams a day. And
that's over a week, 2 weeks type of thing?
I would never stop, to be honest. So the 20 gram dose, I would, only do that during a rehab or as you go into surgery. And then that 5 gram dose kind of consistently. And you hit it a little bit. There's some benefit in surgery, post-surgery. We've seen some good kind of maintenance of strength and muscle. But I think one thing that's hard not to address is the mental component of surgery. Like now you have someone, that was exercising and now they're completely sedentary. There's some fascinating data on the benefit of creatine. We have creatine stores in our brain. So the potential influence, it sometimes is better than an SSRI or like an antidepressant. I'm not saying it's going to cause miracles.
Aren't you glad you tuned in today, everybody?
But it can't hurt the side. I always like to rate kind of the risk to benefit ratio. And so it has some potential to help with that mental, version of being somewhat immobilized.
Right. Good. So all these things that the athletes are listening to this and they're like, oh my gosh, this is so awesome. Why didn't I not hear this 10 years ago? What about everybody else? It's like, I want to get back to work. I want to get back to life, but I'm doing okay. Is this just advice for the person that I got to hustle, I got to get back to my thing? Or is this something that really helps everyone?
Yeah, I'll put in perspective. My grandmother at the time was 95 and she fell. You would believe I would send her some creatine and some HMB. Those were the two, because feasibility, right? Even better for those people that maybe aren't as active, because usually active people spend more time on their diet and they know kind of things to eat. Yeah. Whereas, and again, I'm a food first person, but for people that, maybe aren't doing that as much, like a basic whey protein supplement in between meals and a creatine supplement and a fish oil, like some of these things can really fill the gaps of what they're not doing. And I mean, I don't care if you're not an athlete, like we still have important activities of daily living, getting up out of our car and our stairs and caring for our children. So yeah, I think it's more important for people even that aren't active.
Okay, good. All right. So as I was reading through this, I'm like, this is just good advice for life. Like, put the rehab aside, put the surgery aside. This is just like, we should just all be doing this, period. What's the difference? I guess it's the level of protein, maybe the level of including the H&B more consistently? Any other differentiators between the recommendations here specifically for surgery or post-injury and just what we need to be doing?
Yeah, I mean, I think it's more important. Like we talk, and I'm sure you talked about this with Stu. We talk about protein synthesis and maintaining protein balance, but within surgery and rehab, it is crucial because otherwise you're losing muscle. I mean, I'm sure you can talk about anybody that I'll just dance around here for a minute. Anybody that has had surgery, they see a loss in size of muscle.
Yeah.
And when you think about it, you really want to prevent that. We see athletes and even non-athletes for several years after having that muscle imbalance, which then increases risk for re-injury.
Right.
And so under this rehab, your body has kind of excess needs. And so it is more important to really follow these things, whether you're an athlete or not, kind of, really paying more attention to nutrition essentially and the timing. So one of the figures in there talks about even when you go to physical therapy, what you have before and after. The timing is one of the key pieces that I don't think we often do, especially around physical therapy.
Okay, good. I did not catch that. Thank you for pointing that out.
Yeah, so before and after therapy, I consider that somewhat, I mean, it's all relative, but that's the exercise stimulus. Right. And so we really want to make sure we have nutrients before and after available. That's one of those things, if you have physical therapists or someone working, like I wish that we could put like a basic ready to drink protein supplement in a physical therapy clinic, because then you could just say, hey, make sure you have one of these on your way in or out.
Right. And in terms of timing, is it 30 minutes before, an hour before? Is it just at this point, the research just says before is better than not?
I mean, it depends on the person. It really depends on when your last meal was. So if you had lunch and then go to therapy, then I would say after. If you've been at work all day and haven't eaten anything, well, then before. Okay. And so it's really thinking about, are those, nutrients in your system at all?
Okay, good. All right. So we talked about this earlier. Loved your article, and the timing on a personal level is really important too. Again, everyone, we will link to her article so you can access it in the description, both the video and the podcast. Do we have any hope that this is going to become part of healthcare? As you've had this out there, it was published in the Journal of Athletic Training, so you've got it there on the front lines. Are you getting feedback of people saying, "Oh my gosh, we're going to start using this"? Or I don't know. I just look at this and think, so much potential, and we're not doing this.
Yeah, I mean, I don't think the article is going to change lives, but
what? Well, not until your interview, at least, right?
Yeah, but I think, I'm fortunate. I teach a lot of, most physical therapy programs have a nutrition requirement. It's one lecture. Yeah. But I know, I get to do it here at UNC and I do it at Duke. And so to me, it's kind of starting on the ground up and teaching them during their curriculum, these are the questions that you should be asking, this is how you can do it. And so I think there's hope and I think there's more awareness. And I know depending on, in athletics specifically, a lot of this is already being done because it's a team of sports medicine physicians and nutritionists. To me, it's more important to get it to the general population, because most people don't think I'm not exercising, I shouldn't be eating, or I have an injury, I'm sedentary, I don't want to get fat. And it's really changing that messaging where eating becomes more important and, trying to maintain the longevity of your body. Yeah. So yeah, my hope is that it will have some impact or, even start conversations.
Well, at least you're getting out there for the PTs. We do have a lot of PTs listening to this, so hopefully we'll build on what you're doing at Duke and UNC. All right. So final wide open question. Any final words of wisdom you want to share? I haven't asked the right question, or we missed an angle here that you're like, Brad, there was this really important thing in the article you missed. Anything else you want to throw out to us for people that are wanting to either make the most of their own lives, or they're trying to help other people do the same, as PTs, as coaches, as health and wellness coaches, whatever it might be?
I mean, one thing I would say, normally I wouldn't say go read a research article, but we tried to make this one really readable, practical, and pictures, and it's how you might actually implement it. So in this case, I would say go check it out. It's free. It has some good strategies. And the other thing I would say is like ask questions. I feel like sometimes we don't take enough ownership in our own personal journey, or the people around us, you know, like your parents or the people that are having surgery, and push the envelope a little bit. Like, can I do this? Can my clear liquid be this? Or what do you think about this? How do I accelerate rehab? And that doesn't mean everyone will have the answers, but I think those questions then can help kind of make that rehab process go smoother or faster.
When I think a lot of people don't realize that your physical therapist, your physician, your surgeon, they're learning too. And so when you ask those questions, it just gets them off autopilot. Or as someone who practices as a physical therapist for 25 years, it got me off autopilot. Someone to ask, and I'd be like, that's a good question. Let's check it out. Let's look at the research. And so even if it's just moderately helpful for you, it might help that next person that goes through surgery, that next person that goes see their family practice doc or their PT or whatever. So really good, really good. What's the best way for people to follow you? This is such important information. I want to make sure we get it out there. Is it Twitter? Is there a website? What's your preference?
I'm on Twitter, A Smith-Ryan, and on Instagram, same handle, A Smith-Ryan. And then I have a website that's not updated enough, but Abbie Smith or asmithRyanPhD.com, and email.
Okay, beautiful, beautiful. Thank you so much. This is great stuff, and I really appreciate you joining us today.
Yeah, absolutely. Thanks so much for having me.